CVS Health engages with millions of Americans every day in their communities, helping families struggling with an often confusing, disconnected system and the rising cost of health care. What's driving these costs is understood. Greater demand for care, growing medical provider costs, and persistently high prices for hospital care and prescription drugs. Every day we are addressing the fragmentation and the underlying cost of care. That starts by making care for Americans accessible and affordable, and most importantly, simplifying the patient experience at every point. Our 300,000 employees across the country work every day to meet this moment. I took this role 15 months ago because I wanted to help shape the future of healthcare in this country. I'm proud of the work we have done so far to simplify the healthcare experience and make healthcare more affordable and accessible for American families. I know there is much to do. It requires health plans, providers, and employers working together. That's why we support reforms that increase transparency, competition, and innovation, particularly among hospitals and in the pharmaceutical supply chain. We encourage policymakers to preserve flexibility for employers to offer benefits that meet their workforce needs and to avoid policies that reduce competition or add bureaucracy. We want to work together, first, to explore solutions that bring younger and healthier people into the risk pools. Secondly, expand the definition of preventative care to services that keep people healthy and out of the hospital, and allow people in high-deductible plans to access these services in their pre-deductible phase. Third, address the bad actors who are gaming the No Surprises Act. Centralizing eligibility, automating processes, and increasing oversight can help address this abuse. Fourth, accelerate the interoperability of health records to reduce friction and help patients manage their health. And finally, pass the ECAPS legislation, allowing pharmacists to practice at the top of their license and receive Medicare reimbursement. This will benefit every pharmacy in this country while improving access for patients and reducing cost.
Mr. Joyner, you are the CEO of CVS Health, correct?
Correct.
And I actually don't know how many Americans know this, but CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health Medical Clinics, correct?
Yes, it does.
And in addition to that, they own, of course, CVS Pharmacies, and CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
And CVS Caremark processes nearly 30% of all prescriptions in a given year. And so, in other words, CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the US. In fact, I was following one of CVS's investor calls where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis. Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. I think The Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration is destroying people's ability to access care. I don't think we're seeing this across the board. And if they can self-deal, I saw something that was interesting from the opening statement of Mr. Hemsley from United Health, talking about how much United spends, 85% on care, Mr. Hemsley?
Approaching 90%.
Approaching 90%, but the ACA forces you all to spend a decent amount of that on subsidies on care. But when you own the care, when the insurer owns the pharmacy, owns the PBM, owns the drug manufacturer, you also own the healthcare cost. You own a big chunk of the healthcare cost. And so, 100 years ago, we had this type of market concentration in our banks. And we did something about it when it crashed the economy. And we passed the Glass-Steagall Act. We should be considering that in our healthcare system. And if we believe in competition, I think we should put our votes and our legislation in alignment with that and consider breaking up this industry in order to allow the competition that prevents this kind of vertical integration and abuse of power. And with that, I yield back.
Alexandria Ocasio-Cortez knows that most people have no idea what pharmacy benefit managers are, and that's the way health insurance companies like it. These companies hide in the shadows to skirt accountability and avoid regulation. And in fact, 3 health insurance companies control half the market, and 3 pharmacy benefit managers control 80% of drug benefits. This is only possible because our current system relies entirely on the good faith of some of the largest and shadiest companies in the entire country. AOC has been unequivocal in her support for Medicare for All, recognizing that the current system is built purely to protect the profits of shareholders. People all across America are tired of the old guard, controlled opposition Dems skirting around the actual systemic problems that make being poor in America oftentimes a death sentence. At a time when traditional guardrails and norms are proving ineffective and insufficient basically everywhere that you look, it's time that we look for practical, sustainable ways to improve our material reality. AOC has been teasing a 2028 presidential run, and it feels like the right time for somebody with her energy and political instincts to show what's possible when Democrats dare to dream.